Hello and welcome to my YouTube channel Healthy Panda Official. Today we are going to analysis the powerful disease tuberculosis and its symptoms, causes, cure. Tuberculosis or TB is a serious illness that mainly affects the lungs. The germs that cause tuberculosis are a type of bacteria. Tuberculosis can spread when a person with the illness coughs, sneezes or sings. This can put tiny droplets with the germs into the air. Another person can then breathe in the droplets, and the germs enter the lungs. When tuberculosis, TB, germs survive and multiply in the lungs, it is called a TB infection. A TB infection may be in one of three stages. Symptoms are different in each stage. The first stage is called the primary infection. Immune system cells find and capture the germs. The immune system may completely destroy the germs. But some captured germs may still survive and multiply. Most people don't have symptoms during a primary infection. Some people may get flu-like symptoms, such as low fever, tiredness, and cough. Primary infection is usually followed by the stage called latent TB infection. Immune system cells build a wall around lung tissue with TB germs. The germs can't do any more harm if the immune system keeps them under control. But the germs survive. There are no symptoms during latent TB infection. Active TB disease happens when the immune system can't control an infection. Germs cause disease throughout the lungs or other parts of the body. Active TB disease may happen right after primary infection. But it usually happens after months or years of latent TB infection. Symptoms of active TB disease in the lungs usually begin gradually and worsen over a few weeks. They may include cough, coughing up blood or mucus, chest pain, pain with breathing or coughing, fever, and chills. Symptoms of active TB disease in children vary. Teenagers have symptoms similar to adults. 1 to 12-year-olds may have a fever that won't go away and weight loss. Infants may not grow or gain weight as expected and may have symptoms from swelling in the fluid around the brain or spinal cord. Tuberculosis is caused by a bacterium called Mycobacterium tuberculosis. People with active TB disease in the lungs or voice box can spread the disease. They release tiny droplets that carry the bacteria through the air. This can happen when they're speaking, singing, laughing, coughing, or sneezing. A person can get an infection after inhaling the droplets. The risk of a TB infection becoming active TB disease changes with age. Until children reach age 5, they have a high risk of a TB infection becoming active TB disease. The risk is greater for children under age 2. People in the age group of 15 to 25 have an increased risk of developing more severe active TB disease in the lungs. Older adults, age 65 and older, have a greater risk of active TB disease, and the disease may be more difficult to treat. If you have active TB disease, you'll need to take steps to prevent other people from getting an infection. You will take drugs for 4, 6, or 9 months. Take all of the drugs as directed during the entire time. During the first 2 to 3 weeks, you will be able to pass TB bacteria to others. Protect others with these steps: stay home, isolate at home, ventilate the room, wear face masks, and cover your mouth. In countries where tuberculosis is common, infants often are vaccinated with the Bacillus calmette-guerin (BCG) vaccine. This protects infants and toddlers who are more likely to have active TB disease in the fluid surrounding the brain and spinal cord.